Okay, now it's ready.
Okay, welcome everyone to our presentation. My name is Katie Chancellor, and in our group we have Ashley, Chloe, and Ronnie, and we're going to talk about HIPAA compliance today.
Ronnie?
Next slide. Okay. What is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act. It is a U.S. law that was designed to provide privacy standards to protect patients' medical records and other health information. This information is provided to health plans, doctors, hospitals, and other healthcare providers. It was originally developed by the Department of Health and Human Services, and it provides patients access and control over their medical records and health information. President Bill Clinton signed it into law in August of 1996, and it was originally given to improve portability of health insurance coverage, to reduce healthcare fraud and abuse, and to protect individual privacy of those personal health records. Next slide. There are 5 sections to HIPAA, and each section includes different coverage for different things. So the first one includes protection for health insurance coverage to individuals who lose or change jobs. It also prohibits health group plans from denying coverage to those who have pre-existing conditions or specific diseases. In the Title II, it directs the U.S. Department of Health and Human Services to establish those national standards for processing electronic healthcare transactions, which is really important since most healthcare units are transitioning to electronic use. Title III also includes tax-related provisions and guidelines for medical care. Title IV defines health insurance reform, including provisions for individuals with those pre-existing conditions who are seeking coverage. Title V includes provisions of company-owned life insurance and treatment of those who lose their U.S. citizenship for income tax purposes. Next slide. There are 2 main rules or keys for marketers after HIPAA came into effect, and those include the privacy rule and the security rule. The privacy rule was created to protect the privacy of personal information, and the security rule governs security of the electronic healthcare information. Each of these have to be reviewed by organizations that are using this health information for individuals. The privacy rule protects all individually identifiable health information held or transmitted by a covered entity or its business associate in any form, including media, paper, or oral. These include items such as names, telephone numbers, social security numbers, medical record numbers, photographs, addresses, any information from the patient. Next slide.
Okay. Privacy of patient information. Most people believe that their health information is private and should be protected, which is why the HIPAA law was created, to give rights over your health information. So with this law, you can ask to see or get a copy of your medical record or other health information. And if you want to get a copy, you must request it in writing and pay the cost to copy and mail it. And you can also ask to have any information changed or add information to your file. And your health information cannot be used for purposes that are not directly related to your care with or without your permission. What information is protected by HIPAA? The information related to an individual's past, present, or future physical or mental health or condition. the provision of their health care, past, present, or future payment for health care are all covered and protected by HIPAA. You can ask that your health information not be shared with certain people, groups, or companies. If you do not want your doctor to share your health information with other nurses or doctors at a clinic, you can ask them not to. And you can also ask for other kinds of restrictions, but if it affects your care, they do not always have to agree. Who has to follow these rules? Those who must follow the rules regarding the use and sharing of your health information and medical records include most doctors, nurses, pharmacies, hospitals, clinics, nursing homes, and other healthcare providers. Health insurance companies, health maintenance organizations, HMOs, and most employer group health plans, and also certain government programs that pay for healthcare, such as Medicare and Medicaid. Ways health information may be shared. So HIPAA allows for your information to be shared in the following ways. One, for your treatment and care coordination. Two, with doctors and hospitals that provide you care and to provide payment for their services. Three, to make sure doctors and healthcare professionals give good care. And four, for protection of the public's health, such as reporting when the flu is in your area. And what about behavioral health? There are other federal laws other than HIPAA that protect information related to behavioral health, such as alcohol or substance abuse treatment that is received at federally supported centers. So if that's something that you want to look into, you can look up the 42 CFR Part 2 or look into the Substance Abuse and Mental Health Services Administration.
P stands for portability, and it basically means that an employee, it gives an employee's ability or right to certain benefits when switching employers. So when you're switching a job, it basically means that you will still have the same coverage, health coverage for you and your family. And so it was designed to make health coverage easier for people changing jobs. And most of the 401k plans have portability of benefits and health savings accounts. And certain pension plans and health insurance have portability. So it's not everywhere, but it is very common, and it makes it a lot easier for people to switch jobs and have the same health coverage.
So COBRA stands for the Consolidation Omnibus Budget Reconciliation Act. It is a federal law that may let keep your employer's group health plan coverage for a limited time after your employment ends or after you would otherwise lose coverage. This is called continuation coverage. It only applies to employers with 20 or more employees. Next slide. To receive continued coverage under COBRA, your group health plan must be covered by COBRA. A qualifying event must occur, and you must be a qualified beneficiary for that event. Qualifying events for covered employees, if they cause the covered employee to lose coverage, are termination of employment for any other reason than gross misconduct and reduction in the number of hours of employment. Qualifying events for the spouse and dependent child of a covered employee, if they cause the spouse or dependent child to lose coverage, they are the termination of the covered employee's employment for a reason other than misconduct, reduction in the hours worked by the covered employee becomes entitled to Medicare, divorce or legal separation of the spouse from the covered employee, and death of the covered employee. In addition to the above, the following is a qualifying event for a dependent child of a covered employee if it causes the child to lose coverage. Loss of dependent child status under the plan rules. Under the Patient Protection and Affordable Care Act, plans that offer coverage to children on their parents' plan must make the coverage available until the adult child reaches the age of 26. The beneficiary, a qualified beneficiary, is an individual covered by a group health plan on the day before a qualifying event occurred that causes him or her to lose coverage. Next slide. And these are our references. In the next slide too, you can see more references. And this sums up our presentation. Thank you.